Hey everyone, welcome back to Run Your Science. Today we're going to be talking about cancer, what it is. We're going to be talking about some different kinds of cancers like breast cancer, leukemia, and what you can do to prevent this cancer from spreading throughout the body or catching it early before it becomes maybe even not possible to cure it, and then it might be permanent with you forever. Because some cancers, once they get worse, like secondary breast cancer and then secondary liver cancer, pancreatic cancer, some of them don't even have a cure if you get that far. So if you catch it early, you may be able to prevent it from spreading throughout your whole body, and you can catch it in that one specific location, and then hopefully be cancer free. So first off, what is cancer? Cancer is a disease where abnormal cells divide uncontrollably and destroy body tissues. The body cells grow uncontrollably and spread to the rest of the body. They can start almost anywhere in the human body and are made up of a trillion cells and can be fatal if not seen in the early stages before it spreads throughout the body. So it can start in one area, like on your skin, on your arm, and then spread throughout your whole body, your legs, your chest, your head. It can spread throughout your whole body, and that's where it gets really hard to control and for you to find a cure and prevent it from being fatal. And so a person can either get cancer genetically or through environmental factors. Like you can get skin cancer because of sun exposure. Just like that, those are some of the environmental factors. The biggest one is skin cancer, though, because of the sun exposure. And there are many kinds of cancers, and some are more deadly than others. Some cancers don't even have a cure, like I said, secondary breast cancer, liver cancer, just like that. So pancreatic cancer, just got to make sure we catch it early so that we can stop it from spreading and getting uncontrollable. So there are several types of cancers that a person can have, but these are just some of the most common ones found and researched. We have breast cancer, prostate cancer, melanoma, which is also a really big one, melanoma, leukemia, pancreatic cancer, lymphoma, kidney cancer, skin cancer, and colon cancer. Those are the biggest ones. So what are some early detection for common cancers? So first off, we'll talk about breast cancer. Breast cancer, you can use low-dose x-rays of the breast and are used in mammograms. Regular mammograms can assist in detecting breast cancer early on when therapy has a chance of being effective. And years before physical symptoms appear, a mammogram may frequently detect breast abnormalities that could cause cancer, so it's important every once in a while to get those mammograms checked out, even if you don't think you have breast cancer, just to check it out, make sure and solidify that you're safe and that you don't have any symptoms of breast cancer. So women between 40 and 45 have the option to start screening with a mammogram every year. Women 45 to 54 should get mammograms done every year, and women 55 and older can switch to mammograms every other year. Now we're going to talk about colon cancer. Colon cancer, so you can do regular colorectal screenings such as colonoscopy, which can help detect colon cancer early before it spreads rapidly. And colorectal cancer is the leading cause of death in the U.S., so this is one of the most fatal cancers. The survival rate of colon cancer is greatly increased to 90% when found early, but 1 in 3 people who get the cancer have never been tested or knew that they had colon cancer, and they didn't have any regular screenings at all. So they didn't know they had colon cancer until later on when they experienced severe symptoms, and it was too late to stop. The majority of colorectal cancers occur in people older than 50. For colon cancer, the average time of diagnostics in men is around 68, and for women it's around 72. And early detection for prostate cancer. So the goal of screening is to identify cancer in patients before any symptoms occur so you can stop it before it spreads to the body and just be completely safe to make sure you can be cancer free if you ever do have that cancer. Cancer can be done early by screening when they are more likely treatable, like I said, and by checking a man's blood for prostate-specific antigen PSA levels. Prostate cancer is frequently detected early. Digital rectal examinations, DRE, is also another method of detecting prostate cancer. This is where the doctor feels the prostate gland with the finger inserted into the rectum while wearing gloves and lubrication. Around 60% of the cases are diagnosed in people 65 or older, and the average age at the time of diagnostics is 66 years. The disease is rarely identified in those younger than 40, so it's mostly for people in their mid 45s, mid 40s, like 45, mid 50s, and it's more for the older people. Younger people are less likely to get prostate cancer. But it's important to keep in mind that these screenings are not 100% accurate, but definitely help to identify the cancer early before it spreads. So always keep in watch for those symptoms and take regular screenings to get accurate results is just going to help you be more safe and protected from these cancers. How can you get cancers? How can you get any cancer? It's all based on your habits and lifestyle choices and is what can lead you to obtain a type of cancer. Tobacco use, excessive alcohol use, which is around up to 2 drinks per day for males and up to 1 drink per day for females, and women and frequent blistering sunburns, excessive sun exposure, being obese, and unsafe sex are all risk factors for cancer. So it's always important to try your best to be safe when doing things outside with partners and making sure you're being physically active and eating good food. And so some cancers, they may be caused by inherited genetic change, but inheriting a cancer-related gene does not mean you're 100% going to get the cancer. It means that your risk of getting cancer is increased. So let's say your dad had cancer and your mom was fine. So you have a higher chance of getting that cancer gene because your dad has cancer, but it doesn't mean that you're 100% going to have it. It's just that you're more likely and you have a higher chance of getting it. It's not like you're going to get it, but it's a higher chance because your dad has that cancer gene. And then he might pass it down to you. So that's the biggest thing with that. Prevention. There are many things you can do to help keep a healthy lifestyle and prevent the risk of getting cancer. Don't use tobacco, smoking, any other nicotine devices like vapes, chewing tobacco. It's all bad. Eat a healthy diet, lots of fruits and veggies, alcohol in moderation. Stay physically active, go on runs, bike rides, anything to stay fit and active. And protect yourself from the sun, use sunscreen, avoid tanning beds, and cover your skin. Also, making sure you're getting vaccinated for hepatitis B, HPV, and those can all increase your risk of cancer if you get those things like hepatitis B and HPV, like I said. So just make sure you're getting vaccinated all the time. And avoid risky behaviors, like I said, practice safe sex, and avoid sharing needles. Get regular medical care, doctor checkups frequently, and self-examinations. And make sure to stay up to date with your doctor visits in case you do have cancer so you can catch it in the early stages, like I've said several times. Common types of cancer treatment. If you have a cancer, you should stay connected with the doctor and friends and family, maintain a healthy lifestyle, talk to people who have cancer, what they did, if they beat the cancer, and what are they doing right now if they have the cancer, and anticipate possible physical changes like maybe you're going to lose your appetite, so you might get skinny, so make sure you anticipate that. You're not going to be so surprised when you start losing tons of weight. Along with treatments you can do yourself, see a doctor for possible other treatment recommendations such as surgery, which is an operation where doctors cut out the tissue with the cancer cells. And then you got chemotherapy, which is special medicines that shrink or kill cancer cells that we cannot see. Radiation therapy, which is using high energy rays similar to X-rays to kill the cancer cells. Hormone therapy, which blocks cancer cells from getting the hormones that need to grow and spreading throughout the body. Immunotherapy, which is a treatment that works with your body's immune system to help fight cancer cells or control side effects from other cancer treatment. And stem cell transplant, which is basically a bone marrow transplant, and it replaces bone marrow cells lost due to high doses of chemotherapy or radiation therapy. These are all the things that you can do with the doctor to treat cancer, and these are all things just going to help you be cancer free if you ever do obtain cancer. So these are my sources if you want to take a look at these and learn more about what I said about cancer. I have the healthy habits, breast cancer, prevention. This is from Mayo Clinic, colorectal cancer, detecting colorectal prostate cancer. So I have all the links to where I got my information from today. So if you ever wanted to look more into it, you can go ahead and take a look at that. And these will all be in the video for you to view. And I hope you guys learned something new today and are gonna make sure you keep it up to date with your doctor checkups and making sure you are staying safe and that you can prevent yourself from getting cancer before, or if you do have cancer, catching it early before it spreads and it can't be treatable anymore. So I hope you guys learned something new, and I'll see you guys in the next video. Bye.